Alright folks, let's kick things off with a crucial point about kidney stones. Unlike a stubbed toe or a headache that screams for attention right away, kidney stones are often insidious. What does that mean? Well, for many of you, the stone actually begins to form in your kidney without so much as a whisper. You could be going about your daily life, feeling perfectly fine, completely unaware that this little crystal is slowly, silently growing within you. This initial, asymptomatic phase is why kidney stones can sometimes feel like they come out of nowhere. One day you're great, the next you're in agony. Now here's the kicker. The real show usually starts when that stone decides to go on an adventure. When it either begins to shift within the kidney itself, causing friction and irritation, or more commonly, when it takes a grand dive into the ureter, that narrow tube connecting your kidney to your bladder. That's when you'll know. That's when the sudden onset of pain hits you like a freight train. It's not a gradual build-up. It's often a rapid escalation from 0 to 10 on the pain scale, signaling that your body is not happy with its new internal passenger. Alright, let's talk about the big one, the symptom that often sends people rushing to the emergency room, and for good reason. When we talk about kidney stones, the hallmark sign you need to look out for is that absolutely excruciating pain in your back or side. We call this flank pain in medical terms, and it's typically felt just below your ribs, often radiating around toward your abdomen. This isn't your average muscle ache, folks. This is a whole new level of discomfort. What makes this pain so distinctive? It's known as renal colic, and it's characterized by its intensity and often its fluctuating nature. You might experience it as sudden, sharp, almost unbearable spasms that come in waves, making you double over. Or it could be a more constant, deep, gnawing ache that simply won't let up. The exact location can actually shift a bit too, depending on where that mischievous stone is moving within your urinary tract. But remember, if you're experiencing severe, debilitating pain in your back or side, a kidney stone should definitely be high on your list of suspects. Alright, let's talk about how this pain, the kidney stone pain, doesn't always stay put. While it often starts in your back or side, as that stone begins its journey down the ureter, that little pipeline from your kidney to your bladder, the pain usually radiates. What does radiate mean here? It means the discomfort starts to spread and move, typically making its way to your lower abdomen and groin area. It's a classic progression, a sign that the stone is continuing its descent. Now for you guys out there, this can often include pretty significant testicular pain, and for the ladies, you might feel it in the labia. This isn't just an ache. The intensity of this radiating pain can truly be debilitating. It's the kind of pain that can make you writhe, pace, and feel like you just can't get comfortable. So, if that sharp back pain starts moving south into your lower belly or groin, that's another big clue that a kidney stone is likely on the move and needs attention. Alright, moving on to another common symptom that can sometimes trick people into thinking it's something else. Changes in your urinary habits. If a kidney stone is making its way down and starts to irritate your bladder, you might suddenly experience a sudden and persistent urge to urinate. Now this isn't just a normal I need to pee feeling. It can be incredibly intense, almost like your bladder is screaming at you, even if you just went 5 minutes ago, and it's practically empty. On top of that urgency, you'll often notice a significant increase in urinary frequency. This means you're running to the bathroom a lot more often than usual, both during the day and even waking up multiple times at night. It's your bladder reacting to the irritation caused by that passing stone. So, if you're suddenly making endless trips to the loo and feeling that constant gotta-go sensation, even without drinking a ton of fluids, don't just brush it off. It could definitely be linked to a kidney stone trying to make its exit. Alright team, let's talk about another uncomfortable symptom that can pop up when a kidney stone is on its way out. Painful urination, medically known as dysuria. Now, this isn't just a mild discomfort. It can feel like a sharp burning sensation or even a stinging pain every time you try to pass urine. This often happens as the stone gets closer to your bladder or is literally entering the urethra, the final tube urine travels through to exit your body. The stone is essentially irritating the delicate lining of your urinary tract, and your body is letting you know about it. Here's where it can get a little tricky. This particular symptom, painful urination, is also a classic sign of a urinary tract infection, UTI. So, many people might initially think they just have a UTI. However, with a kidney stone, you might not have the other common UTI symptoms like a fever or chills, unless an infection has developed because of the stone. If you're experiencing burning or pain when you pee, especially combined with any of the other symptoms we've discussed, it's a huge red flag that a kidney stone might be the culprit. And it's definitely time to get it checked out by a doctor. Alright, now let's talk about a symptom that can be pretty alarming to see, and for good reason: blood in your urine, medically known as hematuria. This is one of the most concerning early signs of a kidney stone. When that stone is moving and scraping against the delicate lining of your urinary tract. Remember, those ureters are pretty narrow. It can cause microscopic tears, leading to bleeding. You might see your urine appear pink, red, or even a brownish color, almost like tea. It's your body giving you a very visible alert that something is wrong. Now, sometimes the blood isn't visible to the naked eye. We call this microscopic hematuria, and it can only be detected with a urine test under a microscope. But visible or not, the presence of blood in your urine, especially when combined with pain, is a strong indicator that you likely have a kidney stone. So, if you notice any discoloration in your urine that looks like blood, don't ignore it. It's not normal, and it's a clear signal that you need to get to a doctor pronto to figure out what's going on. Alright, let's move on to a symptom that, while not directly related to your urinary system, is a very common and unpleasant companion to kidney stones: nausea and vomiting. Now, you might be thinking, what does my stomach have to do with my kidneys? Good question. The reason you might feel incredibly queasy or even start throwing up isn't because the stone is in your digestive tract. Instead, it's a reflexive response to the sheer intensity of the pain. Your body has a complex network of nerves, and the severe pain signals from your kidney or ureter can trigger a reaction in the part of your brain that controls nausea and vomiting. So, if you're experiencing that agonizing flank pain we talked about and suddenly you feel incredibly nauseous or you can't keep anything down, that's a strong indicator. It's your body's way of saying, this pain is so overwhelming, I can't handle anything else right now. This can also lead to dehydration, which only complicates things further. So, if you're battling severe pain and also feeling sick to your stomach, don't ignore it. It's a classic partnership with kidney stone discomfort and another reason to seek medical help right away. Alright, let's talk about another urinary change that can be a big red flag, especially if you're already suspecting a kidney stone: cloudy or foul-smelling urine. Now, typically, healthy urine should be clear and have a very mild odor, if any at all. But if you notice your urine looking murky, hazy, or just not its usual transparent self, that's a sign something might be up. Even more concerning is if it develops a strong, unpleasant, or unusually pungent odor. These changes often point towards the presence of something extra in your urine, and that something could be bacteria. Why is this important? Because a kidney stone, especially if it's causing an obstruction, can create a perfect breeding ground for infection. If urine can't flow freely, it can back up, allowing bacteria to multiply. So, if you're experiencing other kidney stone symptoms, and suddenly your urine looks cloudy or smells genuinely bad, it could indicate a urinary tract infection, UTI, that's developing or has already developed, as a complication of the stone. This requires immediate medical attention, as a kidney infection can become very serious if left untreated. Don't ignore these visual and olfactory clues, folks. Your body's trying to tell you something important. Alright, let's talk about a symptom that really signals a potential problem, and it's one you absolutely shouldn't ignore: a reduced urine volume or even difficulty urinating altogether. Normally, your kidneys are constantly producing urine, and you should be passing a regular, healthy amount throughout the day. But if a kidney stone gets lodged in just the wrong spot, specifically, if it completely blocks one of your ureters, that tube draining urine from your kidney to your bladder, it can cause urine to back up. This means the affected kidney can't drain properly, leading to a significant decrease in how much urine you're actually passing. This isn't just an inconvenience, it's a medical emergency. If a kidney is completely obstructed and can't drain, it can swell up and potentially suffer damage. You might notice you're trying to urinate, but only a tiny trickle comes out, or perhaps nothing at all, despite feeling the urge. This can also lead to intense pressure or pain in your side. So, if you're experiencing a dramatic drop in urine output or finding it very difficult to pass any urine, you need to get to the emergency room immediately. This isn't something to wait out. It requires urgent medical attention to prevent serious complications. Alright, let's talk about a symptom that takes the urgency level from concerning to get to the doctor now. And that's the presence of fever and chills alongside your kidney stone symptoms. While the stone itself usually doesn't cause a fever, if it's obstructing the flow of urine and creating a blockage, it sets up a perfect environment for bacteria to grow. This can lead to a serious infection, and when that infection spreads to your kidney, we call it pyelonephritis, essentially a kidney infection. So, if you're experiencing that telltale severe kidney stone pain and you suddenly develop a fever, that's when your body temperature goes up, accompanied by uncontrollable shivering or chills. That is a major red flag. This combination indicates a potentially serious complication, a kidney infection, which can become very dangerous if not treated immediately. It's not something you can just wait out. You need urgent medical intervention to get that infection cleared and prevent further damage to your kidneys. Don't hesitate to seek emergency care if these symptoms pop up. Alright, let's talk about a behavioral symptom that's incredibly telling when it comes to kidney stone pain: restlessness and an inability to find a comfortable position. Now, think about other types of severe pain you might experience, say a broken bone or a really bad stomach ache. Often, with those, you'll try to lie still, curl up, or simply minimize movement because moving makes the pain worse. But with kidney stone pain, it's often the complete opposite. People experiencing renal colic, that intense kidney stone pain, frequently become incredibly restless. They might pace the room, shift positions constantly, try sitting, standing, lying down in every conceivable way, but nothing brings relief. It's like your body is desperate to escape the agony, even though there's no position that genuinely lessens the discomfort. This constant shifting and inability to get comfortable is a classic sign of kidney stone pain and something we doctors often look for when assessing someone in severe pain. It's your body's frantic response to an internal crisis. Alright, let's talk about a crucial point that helps differentiate kidney stone pain from other, less serious aches. It's remarkable resistance to typical over-the-counter medications. Now, for a regular headache, a muscle strain, or even some stomach cramps, popping an ibuprofen or acetaminophen might offer some welcome relief, or at least take the edge off. But with kidney stone pain, you'll often find that those standard pain relievers just aren't cutting it. You might take them, wait, and realize the agonizing pain is still right there, perhaps with only a minimal fleeting reduction in intensity. This is a really important red flag, folks. If you're experiencing severe back or side pain that just won't budge despite your usual go-to-pain meds, that's your body telling you this isn't just a minor issue. The intensity and nature of kidney stone pain often require stronger prescription-level analgesics or even interventions to help the stone pass. So, if you've tried your typical remedies and you're still in agony, don't just keep suffering. It's a strong indicator that a kidney stone is likely the culprit, and you need to get professional medical help to manage that pain and figure out what's next. Alright folks, this brings us to arguably the most critical takeaway from our discussion today: the paramount importance of early recognition and prompt medical consultation. Ignoring these early symptoms of kidney stones can have some serious consequences. We're not just talking about prolonged agony here. Neglecting these signs can lead to significant complications like kidney damage from prolonged obstruction, severe infections that can spread throughout your body, or even more debilitating pain that lands you in the emergency room when it could have been managed sooner. So, if you're experiencing any combination of the symptoms we've discussed today, especially severe pain in your flank or side, blood in your urine, fever, or difficulty urinating, please do not hesitate. Don't try to tough it out or hope it just goes away. It's absolutely vital to seek prompt medical attention. A doctor can accurately diagnose what's going on, confirm if it's a kidney stone, and recommend the appropriate treatment plan to help you pass the stone safely and prevent any serious long-term issues. Your kidneys are vital organs, and protecting them starts with listening to your body's signals.